Aloha, everybody. Thank you so much for joining. My name is G. For those of you who don't know me, I'm with Maui United Way, the Director of Impact. I'm just going to give another couple of minutes to get everybody in and started, and then I'll have the pleasure of introducing Captain Emily Williams.
So see, here's one that's like developed out and closed. You see, these were the milestones.
Right, everybody. In the interest of time, I'm going to go ahead and get started. Again, my name is G. I'm the Director of Impact at Maui United Way. I'm so happy to see many familiar faces and to be able to help to support Maui United Way. So pleased to be able to offer this grant workshop series for our community to help to develop that grant writing muscle, particularly for grants that are federal grants, which can be very complicated. And we're super lucky for today's grants workshop to have SAMHSA here to present on their grant application process. So SAMHSA is the Substance Abuse and Mental Health Services Administration. And we are lucky to have Captain Emily Williams, who's an LCSW. She's the Regional Director for the Substance Abuse and Mental Health Services Administration in the U.S. Department of Health and Human Services Region 9. Her career has focused on underserved populations and has spanned more than 20 years of service delivery for behavioral health services within the Indian Health Service and DoD. From working as a clinician in remote clinics to standing up and a telephone outreach center for active duty family members and veterans, her ability to work with individuals and communities has strengthened the suicide prevention and crisis response in local, state, and national arenas. Since her commission as a United States Public Health Service officer in 2004, Captain Williams has served a central role in conceptualizing, developing, and training federal mental health disaster response teams within the USPHS. And she's served as a team leader and deployed to numerous public health emergencies, including hurricanes, multiple tribal behavioral health emergencies, the 2010 American Samoan tsunami, and coordinated deployments to assist hospitals with accreditation support. So Captain Williams is here to share out. We will be sharing this slide deck afterwards, along with the recording of this. So please feel free to keep an eye out for that via email. We'll also be requesting a survey afterwards. You are all put on mute, so if you want to ask a question, Lindsay will be checking in on the chat. So feel free to chat or raise your hand and unmute yourself before you speak. And again, thank you so much again, Captain Williams, for joining us, and I will hand it off to you.
Hey, everybody. Thanks for having me today. I'm excited to be here. Grants are something that I have a love-hate relationship with, especially with the federal government. So for those of you who have never written a federal grant before, I'm going to give you a little anecdote because it's a fact. Before I worked for SAMHSA, I worked for the Indian Health Service in a small little tribe in central South Dakota. And we wanted to apply for a SAMHSA grant, the very first Circles of Care SAMHSA grant that came out in 2001. So my tribe came to me and said, hey, Emily, will you apply for this grant? You can, put this together for us. And, it'd be a great opportunity to grow some prevention, some culturally relevant things for our community. And I'm like, I'm in, I can do this. And I got in there and I wrote a grant and I thought it was pretty amazing. And then SAMHSA offered, because it was the first grant, they offered some technical assistance in Seattle. And so I got on a plane, my tribe paid for me to fly to Seattle, and I show up at a hotel to get my technical assistance for the quote fine tuning of my grant application. And when I sat down at a table, you were supposed to find your table that had your community name, organization's name on it. And they were big hotel tables of 8. And I went and I sat, and I was a person of one at a table of 8, which was a little intimidating for me. I was like, oh my gosh, this is really scary. But then some of the other groups came, and they were like tables of 16 or tables of 24, because they were multiple groups that had banded together to write one grant. I was a little intimidated. Needless to say, I did not get that grant. There's just like no way to get around that. I didn't get the grant, but I did get a lot of information that really helped me in getting the next grant that I wrote. So what I want to really start out with is to tell you that you might not get the first federal grant that you write, but know that every grant after that first grant that you write is going to be better than the last one. And I mean that with all sincerity. I've gotten several grants after that and felt much better. And now, as I look back at that very first grant that I wrote for SAMHSA in 2001, I'm like, no wonder they didn't fund me. It was terrible, but I didn't know. And so each time I learned a little bit more. So I'm hoping to help you avoid some of the mistakes that I made as we kind of go through this. And this is specific to SAMHSA, but it also applies to other organizations that are within the Health and Human Services realm. So that would be HRSA, FDA, some of those other organizations. USDA uses somewhat of this same format. So just because this is SAMHSA specific, don't think that you can't use the structure and some of the information in some of your other grant writing opportunities. So I'm going to move forward. Just want to talk to you a little bit about the mission of SAMHSA, the Substance Abuse and Mental Health Services Administration. Our real goal is to reduce the impact of substance use and mental illness on Americans' communities. And the biggest takeaway for this is that, especially when you're recovering from a disaster, you need to really understand that behavioral health is essential to health. If you don't have behavioral health, you don't have health. Prevention works, treatment is effective, and the most important thing out of this whole slide is that people do recover. So you may be suffering today, but you may not. You do recover. You have the opportunity to recover and not be suffering always. I'm going to talk to you a little bit today about some of the opportunities that we have for grants. And these are some of the different things that we have for grant announcements, different ways that you find funding opportunities through SAMHSA. I will say that this is the end of the fiscal year. The federal government's fiscal year runs from October 1st through September 30th. So most grants that are out have already been out and are just now being either have been awarded or are getting ready to be awarded in the next few weeks for the coming year. But there's always the chance that there's like a little bit of money left over in an organization and they have what they call some of the discretionary grants, which we're going to talk about. And they'll throw out a very short turnaround for a grant opportunity that is not on the grant forecast or not anywhere else. And so you really have to just keep tracking and see what pops out. So I want to talk to you mostly about the discretionary grant programs that SAMHSA has, because we also have block grant programs, and those are grants that are set by Congress, and we really don't do anything but pass the money through to your states, territories, and tribes. So they are not grants that we can adjust. They're set by your user population, how many people live in your state or community, and they're very different and they're for very specific things. The discretionary grants come from several different buckets, actually. They come from mental health, substance abuse prevention, and substance abuse treatment buckets for services within SAMHSA. So the mental health discretionary grants include a lot of different things that would be relevant to you in Maui right now, especially children's mental health, peer support services, support for children with serious emotional disturbances, and adults with SMI. And a big one is that homelessness. That's I know an issue that continues to be really prevalent and on the minds of people in Maui as you're trying to really find places for people to be and to really regain some of that dignity of their life. But we also have mental health service grants that address trauma. And then, of course, we have our training and technical assistance centers that I'm going to talk about just briefly as we go through. And then there's the substance abuse prevention grants that are really targeted more towards harm reduction, underage drinking, substance use, and HIV. So it's the HIV and harm reduction kind of are linked together in what we do. So a lot of grants will say HIV/harm reduction, but what they are is grants to really support the whole health of a person. Then, of course, we have our substance abuse treatment grants that are discretionary grants that you have drug courts, you have adult courts, offender reentry courts, services for homelessness, again, residential treatment and treatment for pregnant and postpartum women and people. And then, of course, treatment for opioid overdose and opioid abuse. Some of those, the overdose and abuse services are also packaged into the block grant. So there's some money that comes directly to the state of Hawaii to support those services, in addition to what SAMHSA has to offer in our discretionary grants. So we're going to get into the meat of it. So here's the meat of it. Notice the funding opportunities. They're all in these forecasts. So this was for 2024, but the 2025 NOFOs are going to be at the exact same place. So if you click on this link when it comes out to you, you're going to see what they call a grants forecast. And the grants forecast kind of gives you an idea of things that are coming up in the future. And so I'm going to talk about that in just a minute. But really sign up for these opportunities because you'll get them directly. And they really help you to see, what's available and what's upcoming. And the other thing that is really important to see is that when a grant is announced, it's typically open for 60 days. But I think I said there's sometimes those little discretionary grants that pop up at different times. Some of those are open for a very short window, maybe 10 days or 2 weeks. So you really have to pay attention if you're looking for something specific or somebody says, hey, did you see this grant is available? Make sure that you look through it and see where the actual end date is when it has to be submitted by. Because one thing I do know about the government is we're pretty hardcore. When it says it has to be submitted at 11:59, they don't really mean 11:59 Hawaii time. They mean 11:59 SAMHSA time on the East Coast. So that would be Eastern Standard Time. So add 6 hours, take away 6 hours from your 11:59 in Hawaii, and that's when it actually has to be submitted. Another thing I always say is don't wait till the last minute to submit your grant, because there's always glitches with technology. And you might have a problem getting it submitted because of some, internet outage, or there's a glitch in the system allowing you to put it in, and be sad to lose out on a grant because you weren't able to submit it in a timely manner. This is the grants forecast that I was talking about. Everything that's here that we have can be found in the Search Grants tab at the top of the main page of the grants.gov website. And if you look at that, if you click Search Grants and you're looking for anything that's got to do with SAMHSA, and now this is where it comes really important, is because this doesn't just have to do with SAMHSA. You can look for HRSA grants. You can look for USDA grants. You can look for grants for any HHS agency. So you don't just have to look for SAMHSA grants in looking at this. So I want you to really understand that even though, because I'm doing a SAMHSA presentation, I have SAMHSA as your keyword, you don't have to just search for SAMHSA grants in this. You can search for a keyword of something that you're interested in. Like you have homelessness, you can write homelessness in there and it will come up with all of the grants in all of the different agencies that have to do with homelessness. So you don't have to just look at SAMHSA grants. Things that you have to really consider. I think that you're all probably not public organizations, so you aren't probably Hawaii government or federal government employees here listening to Emily talk about grants. So you're really looking at the private or the nonprofit entities. You're looking at some of the things, some of them are institutes of higher education. So maybe, you know, your university system there, a nonprofit hospital or emergency department, a recovery community organization, or a treatment program, or sometimes like an ambulance service. So there's a lot of different opportunities, and professional organizations. So the professional organizations is pretty broad. I know that I've done some work with your Maui Strong, and I know that they have the opportunity, if you're incorporated as a 501c3, you have some of these things as to who can apply. So here's where it gets kind of, I guess, I would say where it gets a little bit more, we're going to put some meat onto the bones of that outside layer that we talked about before. And basically, SAMHSA service grants provide direct services. So there's a lot of things that qualify as direct services. And the reason that I have the National Traumatic Stress Initiative is that I know that the National Child Traumatic Stress group was there in Maui after the fires, and there are opportunities that come up. This, even though it has a grant name behind it, that is not a grant that's available right now. So don't look at that SM 20-005 and think, oh, I'm going to apply for that, because this grant has long closed. But what I really wanted you to see is that there's very clear guidance of what has to happen. And probably the most important thing I would say is what's there in red. If you get a SAMHSA grant, you have to be prepared to start providing some services by the 4th month of the project. And sometimes in rural, isolated communities, that's really tough, especially if you have to go through another board or another organization to get your people hired that you want to have hired for that grant, which is why I really encourage people, when they're thinking about writing a grant, think about who the director is going to be before you write the grant and before you submit it, so that if you're funded, you're able to submit that right away as saying, hey, this is the person who's going to be doing the grant. This is how we're going to start presenting the information out into the community, so that by the 4th month of the project, you're really ready to move forward. And so it kind of gives you an idea of some of the different pieces. And the rest of the stuff on this slide is just actual language that came out of a SAMHSA grant. So it gives you an idea of the things that are required. You know, you need to be able to look at what's in the notice of funding opportunity and see those required activities, and really make sure that your organization has the capacity to implement what they're asking for you to do. Like my little organization, you know, my failed grant application for the Circles of Care grant, we weren't funded because we really didn't have the capacity to implement the activities that were required in that notice of funding opportunity for the Circles of Care grant. But because I was a new grant writer, I had no idea that they really expected you to do every single one of the bullets on there. I thought that maybe it was more of a pick and choose thing, and it wasn't. So how do you apply for a SAMHSA grant? The real key is preparation. I can't stress that enough. Being prepared and knowing what you want and how you want to get it is really the key to success. One of the ways to get successful is getting our little website book that has developing a competitive grant application. And it's right there at the SAMHSA store, and it's free. So I really encourage you to look at this and say, hey, this is where we're at. This is what we have for the support that SAMHSA has to really help you put together a successful grant. Another thing that you might want to look at is that successful grants that SAMHSA has, if it's something that you might be interested in, you can ask for through a FOIA request to have the grants, some examples of grants that were successful. And that will give you a better idea of how things were written or what services were being offered in the grants that are similar to what you're interested in, that would be able to be, transferable over to your project. So you have to move forward, and so having your organizational materials, you want to know what the job descriptions are going to be for the program that you want to do. What are your policies and procedures for the project that you want to do? You also have to have policies and procedures for financial management. That's probably, this little link that I have below here, that's probably one of the most important pieces to have, because SAMHSA has requirements for how you spend the money, but they also have requirements on how you report that money has been spent. And the reason for that is because the SAMHSA then has to turn around and report to Congress how that money has been spent and whether it was spent in the way that Congress intended when they gave the money to us to do a grant with. So what you would really want to do is, I don't know if you have community assessments. I know there's been a lot of data pulled together on Maui since the fire that you could probably use. The Center of Excellence, the Native Hawaiian, Asian American, Native Hawaiian, and Pacific Islander Center of Excellence that's located right there in Maui should have some of this information on substance use and mental health issues that are impacting your community that they could provide to you. If you don't have that data, reach out to the state, and the Department of Health in Honolulu would have some of those services for you. But SAMHSA also has some data that's collected through some of the different grants that we do. So also you can look at that samhsa.gov and then the /data. I will say I'm not a data person, but it really makes your grant stronger if you can include data as to the actual need that you have in your community. The next thing you really want to do is really start gathering that information, and that you want to know what the gaps in services are. You want to know where the need is. Talk to your community leaders, talk to other agencies, or as I always say, form a consortia with other communities that have similar behavioral health concerns, or in your case, not other communities so much, but maybe other agencies that you could work together and really support an active grant application that would be very strong by applying together as a consortium, much like those consortiums of 16 to 20 people when I was a person of one in my organization. So how to apply for a SAMHSA grant? It is pretty basic, but it can be kind of daunting. So we're going to go through all of the little steps that are required. And then you'll be able to take these slides and say, hey, this is what I need to do. So your first step is you really need the registration processes to be completed. Make sure that your project narrative includes all of the things that were on that first bulleted piece in the notice of funding opportunity that comes out. Those are the things that you want to be able to say, this is how we're going to do this project and how it relates to the bulleted points on that notice of funding opportunity. And then keep in mind that it's a 10-page limit. You don't get to write a book, even though you probably are a wonderful writer. SAMHSA is interested in seeing the basics. You also have to have a budget. How are you going to spend that money? If you get $1 million from SAMHSA, how are you going to spend that? And what are you going to spend it on? So you need to be able to not just say with a spreadsheet, you need to be able to include the conversation that happens to really show how you're going to spend that money and where it's going to be spent. And then, of course, because we're the government, we have specific forms that all of that has to be submitted with on your grant application. So you also need to submit job descriptions, resumes for those people that you've selected to be your project director or your point of contact. Letters of commitment from your community are really important to have. How are you going to collect data to show that whatever it is that you're doing is effective? And then of course, consent forms, if you're working with children or taking pictures or working with special needs adults or working with people who would be identified in your program if they didn't have a consent form. And then of course, you need to, of course, provide your documentation of your nonprofit status.
Captain Will, I'm so sorry. We have a question that actually
Sure.
relates back to your previous slide about data.
Okay.
In Hawaii, we only get data for the state, and the needs on Oahu or other islands are different than the Maui County. Is it acceptable to use statewide data, adjusting it by population?
Yes. You absolutely can use statewide data, adjusting it for population. You also might want to look at your Maui County. They may actually have some data that's available that you could use to supplement what you're getting there. And you also might want to look at the, especially if you're looking at substance use or youth, you can look at the Youth Behavioral Health Survey that the CDC does, or the NISDA data that SAMHSA puts out, and then be able to extrapolate from that out into your specific community. Did that answer the question?
I think that's good. If Linda, if you have any follow-up, please feel free to add that in.
Okay, perfect. So this is important. And the registration process is probably the scariest piece that you're going to have to do in any of what you're working for. Because it's not something that people are really familiar with, is how to get a DUNS number, and a Dun and Bradstreet number, where to get stuff at grants.gov. How do you do, your system for award management, your SAM, and that it has to be, your SAM registration has to be up to date. If you changed program people during the time, let's say you had a person that was going to be in charge of the grant, and then after a period of time, they went someplace else, you have to work with a project officer to get that SAM registration changed to the new person, and to make sure that it's renewed every year. You also need to ask for access to the ERA Commons. And I know it says that DUNS number is phased out by early 2022, but it's still there. You just are getting a different number that doesn't say Dun and Bradstreet. So it's still the same. It's the same process. You just get a different number. Then you need to develop a work plan and see who's going to do the different tasks, the different responsibilities for the different pieces of putting this grant together, but also the different people who are going to be providing the services in your community. And that is in Appendix D in the manual that you're going to get for free off of the SAMHSA store. And then of course, identify who you want to serve. Are you looking at youth? Are you looking at serving young adults? Are you looking at homelessness? Are you looking at older adults? Are you looking at serving your grandmas and your aunties who have been displaced? Who do you want to serve? Some people serve everybody, but most grants pick a target of an age group that you're going to be serving, or a category of people that are going to be served. And then you also have to have your measurable goals and objectives. So you put your goals, a goal is pretty easy. The goal is to reduce homelessness. So what's your objective? And how do you get that measurable objective? So let's say we have 50 people who are still in hotels after the fire. So the goal is to reduce that number. So then the measurable objective would be, we're going to reduce the number of folks in hotels by 25% or by 50%. Or if you know the exact number of folks that are in the hotels, you can put that in the goals, and then your objectives, you would say you're going to reduce that number by, that many groups of people that are no longer there. This is where it starts. You start really putting your touch on what you want your grant to look like. These are some of the things that I think are really important. If you look in the middle, it says key evaluation criteria, because overlapping all of those things are the efficiency, the effectiveness, the relevance of the grant, the impact of the grant. But most importantly to me, as one of those overlapping pieces, is sustainability. Are you going to have a grant and then literally in 2 years when that grant ends, you're not going to have any support? So what's your plan to make this a sustainable project? If the project is, once this piece is done, the problem is going to be solved, that's wonderful. But if it's something that's going to be longer term, how are you going to sustain the impact that you've already started to build during that grant period? Sorry, I'm looking at my watch. I don't want to make sure I leave some time for discussion at the end. In your statement of need, you really need to access and reference the data that you have most current, and provide those citations as to where you got that data, how that data is relevant. If, like you said, if you only get state of Hawaii data and it's not always relevant to your community, you need to really look and find some specific community data. And I know there has to be some specific Maui specific data that has come out after the fire, because there was a lot of people there doing a lot of different things in the year since then. And so I'm sure that there is some local community level data that's there, that if you can pull it together, because you really do need to have something beyond the Department of Health data for the Department of Health at Hawaii, a way to extrapolate out to your community and the people that you're looking to serve. Have realistic goals, measurable objectives. Again, there's guidance in an appendix in the notice of funding opportunity that you're going to get. Those goals and measurable objectives have to align with the statement of need that's outlined in section 12. And they need to be smart, measurable, achievable, realistic, and timely. And that's really the key to having a real, I would say, a real measurable goal and objective. You want it to be specific to the time that you need it to, or to the problem that you have. You want it to be measurable, because that's how you're not just going to get money for this grant, but you're going to be able to provide other grant opportunities as you move forward to make sure that your program is sustainable. And you want it to be achievable. And of course, you want it to be realistic. If you're going to say, I'm going to end homelessness on Maui in the next 3 years, we all know that's not a realistic piece, because it wasn't realistic before the fire. So you need to be very realistic about what you're capable of doing, and what your grant will be doing, and when they're going to be doing it. So it's like, it's the timely piece. Are you going to do it in a week? Are you going to do it in 10 years? 10 years isn't exactly timely, because it has to be completed during the time of your grant. You can't say that, well, once the grant ends, we will continue and meet our goal. You have to meet your goals and objectives by the end of the grant term. So you need to look at all of the required activities. Like I said, they're not pick and choose. You don't have to write the whole exactly what's going to happen in each activity, but you do have to put enough to make sure that you can see the grant reader, the person who's reviewing your grant, will really be able to see that detail of who, what, where, when, why, and how. And that, because that's really what they're looking for. Who's going to do the work? Where are you going to do the work? What are you going to do? When are you going to do it? Why are you going to do it? And how are you going to do it? Because if you provide all of that, who, what, where, when, why, and how, you are going to have an amazing grant application, because that's the key to really showing exactly what you're doing and how you want to move forward. Then, of course, have a realistic timeline. I think I already said that, not just the first year, but for the whole time of the project, you need to have a timeline that's there. You need to have those responsible key staff. It doesn't have to be the specific person, but I'm hoping that you'll have a specific person in mind when you're writing your grants, as to say, this is who we want to have do this part. Because remember, you have to have implementation of services by the time 4 months is up on your, when you get awarded a grant. So you need to make sure that you look at all of the things. Something that is new to SAMHSA grants within the last couple of years, I think, is a disparities impact statement. And that is to really help to have you show or state how you're addressing the disparities between the people who have housing and the people who don't. So how the not having housing is impacting their life compared to those who are. You need to have that disparities impact statement in the thing. And there's like I say in this slide, there's examples in that manual. The manual is really important for you to have. I think I said this at the beginning, but don't wait until the end. Don't wait until the 11:59 to push the submit, because there might be submission errors, or there might be things that are not going through the way that you want them to do. So you want to make sure that you have the submission errors and anything that could go wrong addressed before 11:59 on the day that it's due. Now I have a bunch of technical assistance and resources. There's links for resources here. We're going to talk through a couple of them, and then I'm going to really save a little bit of time at the end so that I can stop sharing my screen and start really having a little bit of conversation with all of you about kind of what your needs are and what you're looking for. So here I said this before, I just want to say again, you can ask for successful grants or funded SAMHSA grant applications with a FOIA, Freedom of Information request. It would be very helpful for you if you're a new grant writer to ask for these before you start writing your grant, because it will really help you to develop the narrative that is really needed in order for you to be successful. Because unfortunately, grants are a little bit of a formula. And once you get the formula down, you will just get better every single time that you write a grant. Here's a bunch of useful links that I have. Can't again stress the developing a competitive SAMHSA grant application resource. That is an amazing source for you. Grants.gov is an amazing resource. That's where you're going to find out where the money is, what's available out there. And of course, the Evidence-Based Practice Resource Center. Another thing something I just like to throw out there with the Evidence-Based Practice Resource Center is SAMHSA grants do require you to use evidence-based practices when you're doing a grant, but they do allow for cultural adaptations. So you might, if you're looking at some cultural adaptations, you can call SAMHSA and say, hey, will this fit with this evidence-based practice? And I say that because in tribal communities, there's some evidence-based practices that are very much culturally relevant or adapted to be culturally relevant to the community that is being served. All right, we're coming up to the end. So I just want you to have, I'm not going to have you email me for the slides. They're just going to be provided to you. But I do want you to have my email, because if you have questions or if you have concerns, or you're like, hey, I didn't understand this, I want you to reach out to me, because that's what we're here for. Region 9 is your region, and we are here to support you as a community and as the people who are actually out there doing the work that is so important to your community. We want you to have the technical assistance and support that you need. So we want you to reach out whenever you feel that you have a question, or if you want to talk about something else that has to do with behavioral health, you can reach out to me that way also. So I'm going to stop sharing my slides, I think, and take all of your questions.
Everybody is on mute. So if you have a question, you just have to take yourself off mute. Feel free to ask, or if you feel more comfortable, you can obviously put it in the chat. Captain Williams did such an amazing job. We don't have any questions.
I have a
I see
question. This
something
is
from
Joel.
Lori J.
Can you guys hear me? Sorry.
Yes,
This is Joel Navarro. Captain, on the FOIA website, it asks for what information you're looking for. Is the topic like successful grant
Successful-
applications?
yeah.
Or what would be at the
you
top?
can literally say successful grant applications from 2023 or 2024.
Okay, great.
Just to follow up on that, I imagine if you're looking at a specific funding opportunity, if you can drill down and refer to that grant from the previous year, is probably what you want to do, right?
Correct. Correct. So I always refer back to the Circles of Care grant because that's the one that I've had the biggest failure and the biggest success with. So when I looked at successful grant applications from the year before with a FOIA request, what I was looking for is the project, the actual project narrative. And so I put in for my, what you're looking for your successful grant applications, Circles of Care, project narrative 2023. And that will really narrow it down so that you'll get exactly what you're looking for and don't end up with a lot of extra things.
Thank you. That was very helpful.
Good. Anybody else, or have you all gone to sleep because you're like going, look, good Lord, that's a lot of boring stuff.
Okay. Not asleep. It is
Right.
a lot of information. I think you covered it really well. Thank you so much, Captain Williams. I put the link in the chat, but I will also send everybody an email when the recording is available. So you'll be in the slide, so you'll be able to access that whenever you want, and it's going to be available for you to share with whomever you want. We're going to leave that up there. I'm also going to include a survey when we send this out. It's really important, if you guys don't mind, to please fill out that survey. We want to bring you information that you want to hear, and we can't do that unless you fill out things like a survey. So if you could make sure you do that upon receiving that email, we would really appreciate it. Otherwise, I'll ask again if anybody has any questions, comments, anything like that for Captain Williams while we have her here with us, because she's such a valuable resource. Processing. Yep, I think we're all processing.
All right. Well,
Okay.
just reach out if you have any questions or if you need support in any other behavioral health ways that SAMHSA can support you.
Awesome. Thank you again so much, Captain Williams. We really appreciate your time. And everybody else will give you 15 minutes back. Thank you so much. And if you want to attend our other sessions, you can go on and still do so. We have SAMHSA next week, and we're also going to do some other ones in the future that we'll let you know about as well.
All righty. Thanks, everybody. Have a great day.
Thank you.